Hello friends, I am Dr. Harsh Mathur from Om Netralay, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended, not meant for children. So today we will be discussing how to manage a ball made in the nucleus in a soft cataract. So this is a common problem faced by many, and there are various ways to tackle a soft nucleus. Prolapse it out of the bag, prolapse a pole out of the bag, you do a carousel technique, you do a stop and chop, and many more. These days many surgeons prefer a pre-chopper, but today we will be discussing what and how to manage once a bowl is created. So this is a young patient with a soft cataract 1 to 2. I am planning to do a stop and chop in this case. For the main port, the 2.8mm steel keratome is made. And approximately 3 clock hours away, a side port is then created. 5.5 mm mark is made over the cornea, which will help me guide the rhexis better. My plan is to make a 5.5 mm rhexis with a bent cystitome. Following the mark over the cornea, we get approximately 5.5 mm of rhexis. Now we burp out a bit of viscoelastic substance and then gently tenting the anterior capsule up, we see a nice gentle wave indicating a good hydrodissection. But as the rhexis is on the smaller side, I did not attempt to prolapse the nucleus out of the bag. The nucleus rotates nicely. A bit of viscoelastic substance over the cornea to enhance the visibility, and now is the time to take the probe in. A bit of superficial cortex is removed, bevel turned up, and now is the time to make a central groove. In 1-2 strokes, I thought I had a good depth, tried to crack. The nucleus did not crack, so I went a bit deeper. Again I tried to divide. The nucleus divided partially. Again, so after attempting, I decided to go to the chop, but the moment I tried to crack the nucleus, the hold gave way. I'm trying to now lift the nucleus from one edge, but there is no success. I tried to lift the nucleus with the help of a chopper, but there is cheese wiring. So after several attempts, there is no success, and finally I managed to make a deep bowl in the nucleus. So now the question is how to go about next. If we keep trying and keep attempting to bring the nucleus up with the phaco probe, eventually we'll make a punch hole in the posterior capsule. And I'm trying to do hydrodissection to lift the edge up, but even hydrodissection doesn't bring the nucleus up. So now I decide to try and lift the nucleus up with the help of a dialer, like we do in SICS, and finally I succeed in bringing the nucleus up and out of the bag. Now a bit of 1.4% sodium hyaluronate to protect the endothelium, and behind to protect the posterior capsule. And now we can see that there are small pieces of the nucleus and it should be easy to emulsify. So let's go in again with the probe. Now you will see just with gentle vacuum I am able to emulsify the pieces easily. So once one or two pieces are up, the rest follow, and in no time I am able to emulsify the complete nucleus. Now time to remove the epinucleus sheet. The probe should always be in the central safe zone, and the triangle between the probe and the dialer ensures less of chattering of the nuclear pieces, and eventually we are able to conquer the nucleus. Now is the time to clean up the cortex. With the help of a 22 gauge phaco cannula, the cortex comes out pretty fast. 12 o'clock cortex or the subincisional cortex should be cleaned with the side port. Now the video has been spread a bit. Now is the time to place the IOL in the bag. It is a foldable hydrophilic IOL with the help of wound assisted technique. The leading haptic goes in the bag and the trailing haptic is then gently dialed in. So the take home message is that soft nuclei are the toughest to conquer. There are various ways we can deal with these nuclei, but in case after trying most of the maneuvers in the bag, if the bowel is formed, then do not keep fishing with the probe trying to bring up the nucleus with the help of vacuum, because eventually once the bowel is formed and the soft nucleus, we are very close to the posterior capsule, and if we continue to try and grab the nucleus and bring it up, we will eventually make a punch hole in the posterior capsule. So it's better to do a hydrodissection, or even we can go for a viscodissection. These two maneuvers work pretty well. I hope you like this video. Try it next time. Do let me know in the comment section what are the other ways you practice to manage these bowel in the nuclei. and finally the wounds are hydrated and the case is done. Thanks for watching.